Whenever you're ready.
Hi, I'm Congressman Ron Kind. This week, as a member of the Ways and Means Committee, I had an opportunity to question Secretary Sebelius, Kathleen Sebelius, who heads up the Department of Health and Human Services, the federal agency primarily responsible for implementing the Affordable Care Act. We're 3 years into the Affordable Care Act right now, and my line of questioning was asking her whether or not the cost containment and cost savings that we're seeing under the Act already is sustainable, and if we can build on those reforms. Because not too many people realize that we've been able to slow the growth of healthcare spending in this country, which is crucial to getting our budgets under control. Healthcare spending is the largest and fastest growing area of spending, bar none, at the federal, state, and local level. And it's also a large part of spending for businesses and families alike. So it's imperative that we stay focused on steps that we can take to rein in the cost of healthcare. And we've been getting some information back now over the last 3 years on how successful we've been. For instance, I pointed out to Secretary Sebelius today that U.S. healthcare spending grew at 3.9% over the last 3 years since we enacted the bill. That's the lowest rate of growth in healthcare spending in over 50 years. Medicare per beneficiary spending rose just 0.4%, an historic low. And Medicaid beneficiary, those in the Badger Care program in Wisconsin, spending actually dropped by 1.9% per beneficiary last year. And according to the Congressional Budget Office, who did a recalculation on healthcare spending in both Medicare and Medicaid over the next 10 years, found that we will be spending close to $382 billion less under Medicare and $239 billion less under Medicare these next 10 years, but without denying benefits or the quality of care that people expect from those programs. That's significant improvement, and it's important that we find ways to sustain that, which would go a long ways then to close the budget deficits that we're facing today. But there are other areas that we're recapturing money under the Affordable Care Act. For instance, the authority and tools that Secretary Sebelius has today, we've been able to recapture over $15 billion of Medicare fraud in the system. And we have opportunity to be able to recapture more of that fraudulent payments in the future. Hospital readmissions under the Medicare program dropped by over 75,000 in the second half of last year alone. And the readmission is one of the largest expenses that hospitals face. So we're turning the corner in regards to the readmission rates and finding substantial savings in doing that. The law also provided over $2 billion in rebates to consumers because of overcharging of companies. And the healthcare law provided states resources so they can do a better job to review and prevent excessive premium increases in the health insurance market. We've been also able to slow down the growth of private plan premiums in recent years. Annual premiums now for employer-sponsored family health care coverage increased by only 4% in 2012, the lowest level in only 13 years. And now we're moving forward on innovative payment reform and delivery system reform models that's leading to a more integrated, coordinated patient delivery system and payment model that's rewarding the outcome or the value of care that's given instead of the volume of care. This too is going to be crucial to rein in healthcare costs to make it more affordable for everyone in the system. So while there's progress being made, now we need to build upon that and figure out more bipartisan ways to bend that cost curve, but without jeopardizing the quality of care and the access of care at the same time. I pledge to continue to work closely with Secretary Sebelius and President Obama as we implement healthcare reform. Reform in a system that was in desperate need of reform. And I continually remind people in Washington that we have some of the best models of care in Wisconsin to learn from. So with your help and your input, I want to keep building on this success, but also continuing the reforms that are desperately needed to ensure that health care is affordable and accessible and quality for all Americans involved. I'd be interested to hear your thoughts on this subject, so feel free to contact me by mail, by phone, by visiting my website or Facebook pages, and let me know what you've encountered within the healthcare system and your ideas on possible cost containment so we can get better value for the dollars that are being spent. Thank you.